Hi everyone, my name is Dr. Joseph Hammer, and this is the second Choose Your Own Adventure therapy exercise. In the first exercise that you may have seen previously, we focused on how individual decisions at every point in the conversation can make a difference in whether the conversation in therapy goes in a productive and deeper or less productive and more shallow direction. In this Choose Your Own Adventure, the focus is slightly different and the format is slightly different, and it will be shorter. In this situation, we're looking at how your opening decision as a therapist impacts where the conversation goes. So in this situation, across from you, you will see a client who you're meeting with for a first session, and they will start off by telling you a general overview of what's going on for them. And they'll mention several things that are going wrong in their life or that aren't feeling good. And you'll have a choice, one of three choices, about what you want to ask about. And so your task is to think about what feels like the most powerful or important piece of their issue, and to use the intervention to ask about that topic that seems most important to them. And then you'll see what will happen. So depending on which scenario you pick, you will then see a dialogue between the therapist and the client to see how that ensuing conversation might play out. And after you've picked a path and you see what happens, you can choose to possibly check out the other paths to see what sort of conversation would have flowed from that. So there are three paths, and you can switch between them if you want to see what else might have happened if you asked about other things. So it's a shorter exercise, and this is about choosing what you think will lead to the deepest and the most core part of their issue. And again, this is just based on my professional opinion and teaching people to do psychotherapy. There's always room for error and differing opinions about what makes for a good intervention or asking about a good topic, but I hope that it helps your brain think about doing therapy and is thought-provoking, and welcome your feedback. So, good luck.